Hi, my name is Patty Sheets, and I'm the Director of Quality and Clinical Outcomes. And I'm here today with Marcia Ivy. And Marcia is a Senior Director of Rehab at the Salem Transitional Facility in Salem, Oregon. And Marcia, I invited you today to come to talk to us because you've had some really neat experiences with how you've been using the outcome measures in your building. And I thought that others could learn from what your experiences are. So could you tell us about what you're doing with that outcome data?
Yep, sure. We're using the outcome data in a number of different ways. I think, first of all, on an individual patient basis, and obviously those numbers are guiding treatments and what therapists are doing with patients. And we do make decisions to help our staff in the facility understand how best to care for patients when just their general day is going on. When somebody's outside of therapy, we may use those numbers to help us decide if patients have independence in their room or independence in the hall, and how the staff can best assist our patients. We also use that data in regards to our general treatment planning and our team meetings and care conferences, as well as utilization review meetings. Our RCMs are recording the data and the scores as they change in their utilization notes, and so that gives the nursing access to kind of progress that's being made in a real clear way. The third way, and it's kind of growing even more recently, is that our case managers for the insurance companies are collecting that data, and I've had to do some teaching with them in the beginning about what the numbers mean and what SPPB stands for, which is always fun to help people even learn how to say it and then what it means, and have given them some of the score sheets so they can see what the scores are. But even recently, a case manager has decided, based on an SPPB score, to extend someone's stay based on their score. So I think we're using them in a lot of different ways. It's been very helpful for our patients and our therapists.
That's so great. How about with the nursing? You talked about using them with some of your nursing staff. Has it been challenging for them to grasp the meaning of those measures, or how did you go about trying to help them learn and understand what those different levels meant on different measures?
I think it's taken some time. In the beginning, it was just them hearing me and our other staff say the terms 6-minute walk and SPPB, and just hearing them, and then after they hear them repeatedly, people would ask, what is an SPPB? And so then I would talk about it being a balance test and kind of giving us some information about patients. And after a while, there was opportunities to really do some teaching and give them the score sheets and talk about what level people are and what that means, and give them more information. And at this point now, when I'm in meetings, even sometimes when I'll mention someone's SPPB score, the nurses will even nod their heads and be like, yeah, that sounds about right. So they're kind of even learning the correlation between the numbers and what that looks like for patients, and it's helping make a more efficient conversation for patient care, for sure.
That's neat. Because one of the things when you roll out an initiative like that that's so broad, you worry about a language, first that all of our therapists need to learn, and then you think, well, if it's only a therapy-only language, how useful will it be? And so that's a really nice testament to just how people can learn about new information, and then it can also become valuable to them as well. With the third-party payers, did you have to kind of convince them to take or to use the measures that we had, or was it just that they saw them consistently used enough that, again, they began to kind of understand the meaning behind them as well?
I think maybe a combination. There was some definite intentional education in the beginning, and when we're advocating for someone to maybe stay a little bit longer, to say, that this score has been improving, and, to tell them what the score means. At this point now, though, with one insurance in particular, I just have to throw out the SPPB score, and it's very helpful in regards to deciding whether or not we're going to send someone home right now, or wait a week based on improvement so far, or maybe even look at an alternate placement, and it's been really helpful.
That's great. And what that speaks to is the value of bringing this information about functional status and measures that reflect health status and risk for adverse events into the case management process. So, well, congratulations to you and your group, Marcia. That is great work, and I'm so pleased to hear that it's going so well for you.
Thank you.
Thanks a lot, everybody. We'll see you back here next time.